Hi, my name is Lauren Weiss. I'm a third-year orthodontic resident at the University of Maryland in Baltimore. I'll be graduating at the end of this month with about $411,000 in student loan debt.
Hello, my name is Dr. Tracy Henry. I am a full-time practicing primary care physician. I practice in Atlanta, Georgia, in a medically underserved population. I was asked today to testify before the House Small Business Committee on the burden of student loan debt. The burden of student loan debt is a real threat to primary care field. Primary care is one of those fields where we're making 30 to 50% less than specialists. And so, unfortunately, on the minds of many of our medical students, when they are picking their choice of career, or even our internal medicine residents when they're choosing a choice of specialty, or whether or not to choose primary care, they're thinking about the student loan debt.
My dream was always to own a small business and have my own practice, but now my husband and I are rethinking that plan because of the amount of student debt that I have. Through all of my time during dental school and residency, I really tried to save a lot of money and look for ways that I could reduce the amount of money that I had to borrow. Despite my efforts to do that, I'm still facing this massive amount of student debt that is going to impact my plans for the future of owning a small business.
When we go into medicine, we think about having our own practice and working with patients and the connections and really being able to spend time with our patients. I think now, since you have to see so many patients a day, to pay for the overhead, private practice really just seems out of reach. But it's very important for patients because they know you, they know who you are, you're not just another person. There's a relationship you develop over time. When you're in these big, large practices with hundreds of physicians, each time you come, you're probably getting a different physician. The care is disjointed, fragmented. Sometimes you even get duplication of services because you're seeing a different doctor every time, and then it's also delaying care because that doctor is not going to feel comfortable starting a new medicine, switching a new medicine until they've seen you a second time. But those are some of the perils of being in those large practices. But if you're in a smaller practice, your doctor knows you by name. There's house calls, you can call them, they can call you, and then the health care. Believe the health outcomes are even better, and there's more patient satisfaction.
My overall message for Congress is to not forget about graduate and professional students. A lot of the changes that have been made in the legislation lately have impacted professional students and how we'll be paying back our student loan debt. And overall, just move forward and remember all of the professional students who want to pursue this path, but will ultimately have to give up their dreams of owning a small business in the future.